There you go.
Okay. And outside of Mayo Clinic, she has served on the governing boards of the American Association of Geriatric Psychiatry, Academy of Consultation, Liaison Psychiatry, and American College of Psychiatry. With that, I'm going to turn it over to Dr. Rummans.
Well, thank you so much, Audrey, for that introduction. And I hope folks can hear me. And let's see if I can share my slides. Let's see here. Okay, that's okay. All right, so maybe we'll be able to do this. Okay. All right, oops, there we go. I think that's going to work, and hopefully we'll be able to keep moving forward. So a few months ago, I gave a presentation to the Rotary actually in San Diego, thanks to Bill Wichter and Elaine Case. And so after doing that, they asked if I could do it here in Rochester. So I thought I would update it a little bit. This is a very important topic. I think almost everyone is touched by it in one way or the other, whether it's COVID-19 or whether it's mental illness and substance abuse. And I see a few people in the audience that have been both my mentors, like Frank Sharborough, so I was thrilled to see him, and one of my close friends, Ash Patel, so they can join in the discussion a little later as well. So mental illness and substance abuse today. Let me just give you a little bit of the background. Mental illness and substance abuse has increased to more than 1 in 3 people that have either one or both these problems. That means everyone in this group, a third of us, have either had or do have a mental illness or a substance abuse. So everyone is touched by this, either by yourself, your family, or your friends. Even back in 2013, the cost of mental illness and substance abuse in terms of medical care, institutional care, loss of income, decreased work output, was higher than any other medical condition. And that includes heart disease and cancer, which are the most common medical problems. Over the last year and a half, since COVID-19 pandemic developed, both the number of people with these issues and the cost of these issues hasn't just risen, it's skyrocketed. So let's talk a little bit about viruses and mental health and substance abuse. Why would that happen? It's been known since the 18th century that viruses can produce mental illness, primarily psychosis. Following the pandemic of 1918, there was a spike actually in schizophrenia following the pandemic. The mechanism for this, though, is not completely understood because the research in mental health, it really takes a back seat to the research in other medical conditions. But it probably has an impact on both the immune system, which may produce what we call epigenetic changes, not just formal genetic changes, and or direct brain changes that are probably the causes. So over the last year and a half, there have been both direct or what we call biological or indirect or social ramifications in the mental health and substance abuse world because of COVID-19. Those with pre-existing mental health problems, such as schizophrenia or severe substance abuse, really are at higher risk for even getting COVID. And then even worse, problems from the infection once someone's got it lasts longer than just the acute illness and are leading to significant problems down the road, which those of us who are in psychiatry are seeing almost daily. So the agenda for the next 15, 20 minutes, because I want to hear some discussion from all of you and questions you have or how this has impacted you personally. But what I'd like to do is just report a little bit about what is known about the direct and indirect impact of COVID on mental health and substance abuse. And then what are the implications for us moving forward? So let's talk a little bit about both. So the direct implications of COVID or the biological aspects of COVID. There's probably 2 major direct mechanisms. This still is, we're on the learning curve of this. So basically the information that's coming out is changing on almost a daily basis. But what we do know as of today is that there has been now shown, and this has come out in the last 2 weeks, true viral damages to CNS tissue. sometimes even in the limbic area, which controls both memory and emotion. The virus itself, as we all know, can cause inflammation though. And it's not just inflammation of the lungs or inflammation of the heart, but even inflammation of the brain. The virus also causes hypercoagulability, and with that, cerebrovascular damage because of the thrombosis and even strokes. So what about indirect or social implications of COVID? I think everybody's pretty familiar with these, especially last year. Things are opening up now and it's improving, but there's still ramifications from the isolation and loneliness people felt in 2020. The loss of jobs and income, the loss of housing and food support, and then even trauma that people experience because of either getting sick, knowing someone who's sick, or then experiencing the loss of someone because of dying from COVID. So what are some of the direct problems that result from COVID-19? I think most of this is known to all of you because these were things that came out early on in the recognition of the pandemic. Some of the earliest signs and symptoms are mild, could be the loss of taste and smell, headaches, dizziness, fatigue. More the middle stage or more moderate problems can be what they call brain fog, but it's mild cognitive difficulties. And then really the late stage or severe stages, which often occurs with individuals who are older or have pre-existing medical conditions, can be the things that you have listed here: delirium, psychosis, and strokes. And this group is often the ones that unfortunately experience the mortality of COVID-19. So what about the lingering aspects of this unfortunate illness? What we found so far to date is that probably a third of the outpatients and up to a half of the inpatients who have had COVID have lingering neuropsychiatric problems. And as I mentioned before, this can be because of the brain changes that we're now starting to find. The most common lingering symptoms can be fatigue, malaise, brain fog, but there are a whole host of symptoms, and every single person's situation is different than the next person. So there's not just everyone's going to have certain things, but these are the ones that are the most common. And unfortunately, even those individuals who are under 40, younger people who are having mild symptoms or maybe even asymptomatic initially, what we're finding is if they have mild symptoms, some of these linger, but there are individuals who have been asymptomatic and then about a month later develop new problems with fatigue, the brain fog, the dizziness, tremors, headaches, and myalgias. But the things that we're seeing a lot of in the mental health world, of course, is a worsening depression, anxiety, and irritability. And then we'll talk a little bit more about alcohol and drug issues. Some of the research, though, has shown that even those that have some of the lingering symptoms improve a little bit when they are ultimately able to get vaccinated. So that's a positive note here. So what about some of the problems that result from kind of a combination of both indirect and the social and the biological symptoms of COVID? I think both, all of these, depression, anxiety, fatigue and insomnia, PTSD, which is post-traumatic stress disorder, and even just stress overall, have both biological and social components to them. And you can see how much they've risen just in the last 1.5 years. So it's significant. One of the things that's been the most disturbing to me and to my colleagues is the issues that we've seen with suicide. Initially in the pandemic, there was a decrease actually reported in the suicide rate at the CDC. But what they started finding out is that folks who the suicide rates were actually increasing were those that were younger, some of the minorities, essential workers, and unpaid adult health care providers. So what has just recently come out is the group of 12 to 17-year-olds, especially the girls, there's been a 25 to 40% increase in suicide attempts from the late 2020 to the early 2021 compared to the whole year of 2019. 90% of those who are trying to attempt suicide have had underlying mental health issues and substance abuse that were not diagnosed. And I'll talk a little bit more about that later on. So what about some of the indirect problems that result from COVID? In 2020, the emergency room department visits for mental health crisis just skyrocketed. The suicide attempts, like I just mentioned, but the drug overdoses have just gone up exponentially, that we'll talk about in a minute. Individuals who are isolated or staying with individuals where they were experiencing partner violence, child abuse, and neglect definitely increased more than it had been in 2019. Some of the factors that have been identified and just were published in one of our major journals, the social isolation, economic stress we've talked about, but some of the things that aren't really pointed out is individuals can be a part of a group, whether it's a faith-based group, a group like Rotary, a community group, that's really a very important part of an individual's life, that community. And during COVID, when everybody had to stay isolated, those networks decreased dramatically. And for individuals who were by themselves anyway, this played a major role in individuals having the depression, anxiety, and other things down the road. The barriers to even just getting mental health treatment or substance abuse treatment. Their own other medical problems being ignored, diabetes, heart disease, the rate, talking to my colleagues in cardiology and neurology, the number of individuals coming to the emergency with heart attacks or strokes dramatically decreased for a few months. They were all just dying at home instead. This has now been corrected, but it was substantial at the very first part of the pandemic. And then the negative news that we all have been experiencing 24/7 has not been helping matters at all, as well as the access to firearms, as everyone knows. So what about alcohol and substance abuse? In March, you may have read about how the sales of alcohol dramatically increased from the year before, 54%, as you can see. Since the end of 2020, there have been over 90,000 overdose deaths, compared to 70,000 in 2019. So this is dramatically increasing. And the types of overdoses that you're seeing are a lot of the drugs that are coming across the southern border, whether it's fentanyl, whether it's meth, cocaine, lots of these issues, fentanyl being the number one worst of the offenders. But there's been an escalation of abuse of just about every drug. We're seeing a huge increase in the psychostimulants, including cocaine and methamphetamine, in our emergency room in Rochester, Minnesota. And as I think many of you probably know, heavy alcohol use is associated with weakening the immune system. So that just sets someone up more for being exposed to a virus and then getting infected with it. And then the long-term problems for heavy users can be clear biological changes that leads to dependence on the substance, as well as long-term medical problems that I've already mentioned. So what about the potential societal impact of COVID on mental illness and substance abuse? I'm going to give you just some of the background before COVID. So this data was as old as 2016, but it's pretty dramatic. We don't have the updated information right now on 2021, but we will by the end of the year, which I think is going to be much higher than what I'm reporting here from 2016. Half of the homeless people all over the country have either a severe mental illness or substance abuse. It's not that they've just lost their job. That's a substantial part, but they're huge mental illness and substance abuse. And this has dramatically increased since the 60s and 70s when the state hospitals started closing. As a result, many people with mental illness and substance abuse end up in the local jails and in the prison system. There's one of the district attorneys in Florida who's taken this on as his own personal mission to try and start dealing with a more humane way of dealing with mental health issues than just putting people in jail or prison. And as you can see, 70% of the youth in juvenile justice system have at least one mental illness or substance use problem. This should have been addressed so that they didn't end up in the juvenile detention centers. This is one of the things that bothers me the most. Only 40% of the US adults with a mental illness ever get help. And that, if you look at other medical conditions, this is so far below what other medical conditions would be. But the things that is extremely disturbing, that the number of hospital beds for psychiatric patients has dramatically decreased. And it's the lowest it's been in 100 years. And just for a point of reference, Minnesota is the second worst state in the union per capita of psychiatric hospital beds per capita. And we have individuals sitting in our emergency room at the Mayo Clinic. We've had individuals with mental health issues that need a hospital bed that have literally had to sit in the emergency room for a month. It got so bad that we ended up having to open a wing in the Francis building just to have the overflow of patients. That's improved right now, and it varies all over the map, but it's extremely rare for individuals to come into the emergency room and be able to find a bed that day in the entire state. Usually it takes a few days, but it's been severe. You can't imagine if you went into the emergency room with a heart attack or a stroke or something like that, that you'd be sitting in the emergency room for days, but you do with mental health issues. So just some of the conclusions from a short term. Many of those directly infected with the COVID struggle with new and lingering mental illness and substance abuse problems that we've already talked about, as well as the indirect problems from COVID that have been impacting them both socially and economically. In the long haul, some of the post-COVID inpatients that have developed severe depression have a lot more anxiety, motor symptoms, and suicidal thoughts. So they have even a more intense major depressive problem than they did before COVID. Some who have not even had significant neuropsychiatric symptoms with the acute symptoms of COVID may still develop the long-term psychiatric and neurological symptoms, as I mentioned before, even a month or so after being infected. And this, to me, is very troublesome for the children who, of course, aren't infected at this point and are already getting COVID. And I think probably you've read about the disseminated encephalomyelitis that occurs from COVID. And we don't know what the long-term effects of this is going to be, or even for kids who are asymptomatic, and spread it, but we don't know what the long-term effect will be for them as their brain continues to develop. We are learning. The one thing about COVID that I think has been positive is that we're starting to learn that we really need to be focusing a lot more on our immune system and how it's impacting not just mental immune system is being impacted by things that we don't even know about. There are lots of viruses and organisms on this planet that we haven't even identified and are probably the source of many of our mental health and probably medical conditions, and probably cause epigenetic changes. So it's more than just the genetic changes that go on. We're also learning that some of the medications that have been used to treat the symptoms of mental health issues actually have a mild anti-inflammatory property, which has been very interesting to many of us. So what can be done? I think first thing is we just, you guys are wonderful to want to even hear about some of this, but just acknowledging that mental health problem really needs as much attention as the other medical issues do, and not just in the era of COVID. We need to educate people about the facts, and everyone needs to get involved. It's not just the individuals who have the illness or their families, but everyone to get involved in trying to deal with this. There's a very interesting study, a report that was just published in JAMA Psychiatry in the past month, showing that lay people providing regular empathetic listening, so just connecting on a very regular basis, weekly to daily, for older, lonely, and isolated people, dramatically improved their feelings of loneliness, depression, anxiety, and just general mental health. So I think that just shows that everyone can play a role really in improving the lives of others. So with that, I want to thank you for listening, and I would love to have a discussion about anybody's personal impact of COVID or questions that you might have.
Thank you very much, Terry. That was wonderful. I learned a lot. I'd like to open it up for questions. If you're on Zoom, please put it in the chat and we'll read the question so that everybody can hear it. I have a question. What does the pipeline look like for mental health professionals? Are we getting enough mental health professionals joining the
No,
ranks?
no. I mean, that's an excellent question, and not at all. We're being overwhelmed. Our appointments or they cut them off at 3 months, but if we were to open our calendars, we could be full for 6 months. And obviously individuals who have problems like this need help right away. They can't wait 6 months for an appointment. That's a very good question. No, we're way behind.
Yeah. We have a question here. One moment.
I was just wondering what the efforts are, Mayo Clinic and OMC, to improve that. If there are some solutions or some interventions to increase that profession. I know personally myself, my son is on a waiting list for psychiatric help. He goes to OMC and the child psychologist is no longer at OMC. So I know he's on a waiting list. I know my daughter is on a waiting list too for some sensory issues. So, I mean, that's a personal example right there.
Terry,
Yeah.
go ahead.
ahead.
I'll answer. Oh, I can talk about what Winona State is doing, and then you
Go
can
ahead.
jump in. Yeah, so Winona State has launched a psychiatric mental health nurse practitioner program, which has been very popular. And then we also have different levels of folks that are able to provide counseling, like clinical mental health counseling, drug and alcohol, and masters of social work. So all of those have come about really in the last 3 years. And so it takes a while to get through those programs and become providers. And I think really those are folks that will probably be providing some in this area and greatly in rural areas that actually are much worse off even than what Terry shared. So rural providers are so desperately needed. So we're working hard to make sure that everyone has a care provider.
Terry, talk about other local efforts.
Well, I think some folks may know they're trying to develop a crisis center here in Rochester, but once again, we don't have the staff to really staff it. We're trying to stretch thin the staff that we have in our department to try and help do it. But it's tough. It's tough. We really need to be built. We need to have more state psychiatric hospitals. We need more beds in every single state. We need to be able to train nursing staff, psychology staff. We need to be recruiting more physicians for psychiatrists, social workers. So I think some of the focus from our government needs to relocate some of the funds that they're doing for some things and look at mental health and substance abuse as well.
Okay.
Hi, Terry, Phil Carcel. I'm wondering if it's hard for me to think from a biologic standpoint that COVID is a unique, one-of-a-kind virus as far as the pathophysiologic changes you mentioned in the brain. Are we on the cusp of finding out that other viruses or other viruses in the same family cause these similar changes?
I think that's a great question. That's why I brought up the pandemic of 1918. There was a spike in schizophrenia following that diagnosis of schizophrenia. So I absolutely believe that there's a whole host of viruses that produce different things. And some of my friends in other fields of medicine are starting to show, even some of my friends who are cardiologists or rheumatologists are finding that probably some of the illnesses that we've thought were related to other things are probably virally related, including coronary artery disease or something like that. It's some type of inflammatory process. It doesn't have to be a virus, but something in the environment's causing an inflammatory process. So we'll see where the research goes. I hope we do start looking more at this.
Thank you. Are there some online? Do you want to go ahead and?
No, I thought.
I can't see them on my phone.
We have one question in the chat. Maybe you can see that, I'm not sure. Paul says, in the past, difficult to get insurance companies to cover mental health care costs. Has this improved or is it still a problem?
That's a great question. And yes, it's still a problem. Absolutely. Because it's what I was kind of alluding to in the presentation. There's still this idea that mental illness is, something that you should just be able to pull yourself up by your bootstraps and move on, or just change your social environment and you should be able to do just fine. And unfortunately, that still lingers in some areas, and it's just like every other medical problem and should be funded just like the other medical issues. But unfortunately, it's still lagging behind.
I can't see the chat, so someone, are there more? That's okay. Other questions from the room?
Could you
Yeah.
ask it for me? And that is just, she mentions the benefits
Here.
of certain drugs that,
Here, I'm going to bring it to you.
okay. Yes, this is from a non-medical person. And towards the end of your presentation, you mentioned something about some of the medications, if I got this right, that they were somewhat helpful from the standpoint of being anti-inflammatory. Can you speak a little more about what this impact of anti-inflammatory is?
Yes, thank you. Yeah, I mean, there was a study even published in JAMA, which is one of the Journal of the American Medical Association, one of the major medical journals, on a fluvoxamine, which is Luvox, which is an antidepressant, showing that it had anti-inflammatory properties. And, as I mentioned, the inflammation is one pathway to causing problems from COVID. It's not the only one, but it's one. So having medications that might blunt that inflammatory process might be helpful. There are no direct studies right now using Luvox directly to treat, COVID, but it did show that it did improve the inflammatory issues associated with the medication, with the COVID. And we just don't know the properties of other drugs. I mean, I think, this came out of the blue. So I think that we need to be looking at a lot of the medications we have that treat a whole variety of problems to see if they may have some anti-inflammatory properties. We just don't know.
Okay, thank you. Oh, I have another one. One moment.
Gary, this is Ally. I really enjoyed your presentation. I'm wondering if there is historical summaries of how the medical community dealt with the 2018 or the 1918 pandemic. Was there, a noted rise in mental illness, inflammation? Was science advanced enough to be able to document the very sophisticated ways in which the profession now has been able to tie all the sequelae of the pandemic?
Thanks, Ally. Unfortunately, no, the science wasn't there at all in, the 1918 pandemic to look at any of that. So,
One moment.
Hi, this is Merlin Rickles. This is a thought that might be a little bit off the wall. But years ago, I often began to observe that we as a nation have been a nation of frontiers, first to the west and then go north, young man. And we are at a point where we do not have those frontiers anymore. I've often thought that those many folks who didn't feel like they fit within society would go west and they'd go north. Has anyone ever thought that through? Is there any credibility to the fact that we no longer have a frontier? Those people don't feel like they fit within our society, now have to fit within our society.
okay. I was having, unfortunately, the sound was going in and out for that question. Can somebody just kind of summarize the question? I'm sorry, I just didn't hear it all, so it's
Yeah,
hard
no
to.
problem. The question was, as white people expanded westward, people who didn't fit in may have gone west, may have gone north. But as we really don't have frontiers anymore and people have to fit in, does that impact what's happening? Is that a fair representation?
Yeah.
Okay.
I don't know that I could answer that question. I have no idea. But I do know that one of the things that has been the most dramatic for me, seeing how I've been to Africa a number of times on mission trips and talking to folks about how mental health is dealt with in Africa, families help more. And I think what's happening and what we've seen in the US is sometimes when individuals get a severe mental illness, their families kind of wash their hands of them and just don't allow them back into the family at all. So they're basically lost. That's why you've got the increase in homelessness and everything else going, which is very different from Africa. They'll keep them around. They keep, hovering around them and will protect them. The homelessness isn't the same.
That's a great observation. All right. All right. Thank you so much, Terry. I think we've done a great deal. As we close out today, I want to give thanks to those who joined us, who assisted today. Joel, our greeter, Bill for leading us in the four-way test, Janine, who provided the reflection, Colin at the visitors table, John Woodruff, our sergeant at arms in the visitors table, and a special thanks to our speaker, Dr. Terry Rummins. Thank you all. Serve to change lives. We are adjourned.